At the Health Science Centre Children's Hospital, construction began on Canada's first Indigenous Healing Space.
A historic day for all of us. This project has been accomplished through meaningful work from many sectors, and I want to thank Stefano, his staff, and everybody that's contributed to this important sacred project, who helped design the healing space for all of us here, and more importantly for our children. And I want to thank Grand Chief Kyra Wilson. Thank you for the Assembly of Manitoba Chiefs for endorsing this project. I think with your endorsement and the chiefs across Manitoba, it's really driven the pace of being able to bring this project to fruition. So thank you very much.
The project was made possible through government and community partnerships, grounded in the shared understanding that Indigenous people need a space created by and for their own communities.
I say this I say this in a joking way, but at the same time, it comes from a place of great humility as well too. When I talk about myself, Premier Canoe, as being just a couple of res kids who now get to be able to stand up here and close some gaps. So we have this opportunity to close gaps here by making spaces that are all inclusive. So for us as government, a contribution of $1 million to the Children's Hospital, of which half of that, $500,000, will go towards creating this space. So again, a small step to be able to create some spaces where people will feel welcome, people will feel at home, people will feel like it truly is their space. Those families, those children will have a place to heal, to gather, to share their language, to share their culture, a home away from home, if you will. So having spaces such as this is paramount, because sometimes, and you can see people when they come to the hospital maybe on some of their most difficult days. So if there's things we can do as society, things we can do for our young people to make them feel a little bit better on some of those most trying days, then we should do it.
With so many First Nation, Métis, and Inuit children coming through the hospital, the space is a vital part of supporting their healing.
In our children's hospital, more than 60% of the children we serve are Indigenous. And in some of the wards that we serve children, nearly 100% of the kids served are Indigenous. This is just not about culture or capacity. It reflects the ongoing impacts of colonialism, systemic inequities, and barriers to preventative care that Indigenous families continue to face. When we all see those numbers, we are called to respond, not just with treatment, but with respect, equity, and culturally grounded healing. Today, we're celebrating not just the start of the construction of the Indigenous Community Healing Space, we're celebrating a first for Canada. This is going to be our country's first Indigenous healing space in which funding has been driven by our community of donors. It's a first for Canada because its design is entirely Indigenous-led, reflecting the voices from children, from families, and community leaders, gathered by a tremendous outreach effort by Dr. Morris, spanning several years across our province and beyond. It is making ways so families can nurture their bodies, their hearts, their minds, and spirits, and is a direct response to the Truth and Reconciliation Commission's call to actions to recognize Indigenous healing practices.
The Indigenous Healing Space was opened in a good way through an elder's teaching in Smudge, grounding the space in the cultural traditions of the people who will use it.
I'm sorry that I missed the beginning of the opening. I'm sure that there was some prayers, and I'm sure that there was a pipe ceremony and water ceremony. And so I just want to say thank you to everyone that's been a part of that. It's so important that we are incorporating that spirit to the spaces where our people are going to be. And when I say our people, I mean Indigenous people, First Nations people, our Inuit people, everybody that is going to be utilizing this space. It's important that we open the space up in a good way with the spirit and ceremony of our people. So I just want to say miigwech for that. And just thinking about what this space represents, I know that when our families, our Indigenous families, they come into the hospital, it can be a very scary place for many people, for our children. And you know, this space represents a place where they're seen and they're respected, and where their culture matters, which is so very important for our children, that they feel like they're a part of something, they're connected to something, and that's what this space represents. And so I'm just so grateful that this work is being done. Thank you again, Dr. Morris, for your work.
A decade in the making, the project was built through community consultation, including direct conversations with the children and families who will rely on the space.
10 years ago, Leah Gazen and I went from top to bottom, and we wrote down a list of 10 things that we want to change in the hospital, including food or even the television and access to, say, APTN or something like that. We had 10 items, and so we applied for a reconciliation grant and got denied. But the Winnipeg Foundation came to me and said, if you could pick one thing on your list. And I said, well, let's start with the space. And from there, we can grow human resources, we can grow access, we can grow music and ceremony. And it started with quite a small space. But what's so extraordinary about this journey is the voices that came in. I was in Sioux Valley talking to grade 6 students about this project. And one of the grade 6 students said, if you have Saskatoons on the wall, I know you thought of me. And one kid said, if I can smell sage, I know I'm close to home. And I was like, these are the messages that drove the evolution of this space. Also, I will mention that grade 6er I was walking out. He's like, finally, somebody took my opinion. Anyways, but the elders have brought in visions about what is meaningful to families when they're here. And the elders helped design that circular room where a ceremony can occur. One of the other things about our patients is that they're here sometimes for very long periods of time, like Janessa told us, and Antonina. Somebody mentioned coming of age ceremonies, and we could have a place to hold that. And then also to celebrate life when there's birth. We have large families, and we have no place for them to gather. And also grief. When a child passes, we don't have space where families can sit and honor that moment and honor the practices around that moment. And so these things have helped us design the shape and scope. There's things like the literacy project came in later and things like that, all kind of helped us shape it and change it so that it could both incorporate all cultures, which is in and of itself something that is important to honor but not overwhelm.